3, 2, 1, and action.
Welcome to the new episode of the Back Chat with the Back Doctor. With me, I have the wonderful, amazing Dr. Ben.
Thank you for having me.
Oh, always lovely to have you today. And today's topic is going to be bulletproof your lower back. One of the most popular, one of the most asked for topics to be talking about. Yeah,
absolutely. You're right.
So before we get into that, I would like you just to give a bit of an overview about yourself, Dr. Ben, for those who have not met you.
Of course. So, hey everyone, Dr. Ben. If you haven't met me, I'm one of the associate chiropractors here at the Back Doctor. I've been here going on 3 years now.
3 years?
Yeah. So it's gone remarkably fast. And two things about me is I love two things, beginning with C. One is chiropractic, and the other one is coffee.
All right, I'll drink tea to that.
Cheers. Excellent.
Alrighty. So let's specifically talk a bit more about your background. All right, a bit more of your background and why do you love focusing so much on the lower back?
Yeah. So I finished my chiropractic degree at the University of Queensland. So 5 years of study to become a chiropractor. And I actually got into chiropractic through hurting my back as a teenager. Rugby accidents. I went and saw a chiropractor and I got a relief under care. So I decided to become a chiropractor and here I am many years later, fixing spines, changing minds.
I love it. I hope that, all the people that we help every day, some of them will become chiropractors in the future as well. So
absolutely,
it's an exciting prospect.
Yep.
So let's talk a bit about the lower back now and what exactly causes lower back, because a lot of the time people have lower back pain but they don't know why.
Yeah, absolutely.
So what's your experience with the causes of lower back pain?
Well, just in terms of, the problem, the statistics of lower back pain, around 80% of people in the world will experience chronic lower back pain, or at least an episode of lower back pain.
80%?
Throughout their lifetime. Yeah, absolutely. And in terms of cause, something that's not really well spoken about or even well addressed, essentially stress causes problems, including lower back pain. And there's 3 types of stresses out there.
I was just going to say, is it like this type of stress? Or?
Well, yeah, kind of. Well, it comes in different forms. So it's known as the 3 T's. So you have the thoughts, emotional stress, things like sympathetic dominance. Yeah. So think about it this way. When you're angry or when you're you're down or you're anxious, is your body more tight or less tight?
Well, I just did an angry face and I just
more tight. We hold it in our musculoskeletal system, So that's the thoughts, the traumas, okay? So this is life's physical stresses. You got the big things, those slips, falls, accidents, injuries. Ever had any of those before?
Heaps.
Can't get through life without having one, right?
Yeah.
And then, of course, 90% of the problem, which really goes underdiagnosed, underchecked, is the micro traumas. And these are the results of our bad habits, our deficiencies, our poor postures over time.
Okay.
Things like looking down into screens, things like poor posture, sitting incorrectly, things that cause stress over time. And before you know, it's like the straw that breaks the camel's back.
So we're talking things like one-sided sports, like golf, tennis.
Absolutely.
Because you're always twisting one way.
Yeah.
What about things like bending, like lifting?
Yep, absolutely. Yeah. Repetitive micro trauma over time. So being in this flexed posture, a lot of life is, this could be from picking up something incorrectly, just even standing over a basin too far away from it, causing this posture over time, causing a lot of stress to your spine. Yeah. And everyone has different stresses.
Yeah. So why? How does those micro stresses actually cause lower back pain?
I love it. So if you have pain, it's already too late. So you can have a problem, right?
Yeah.
And not even feel it. And this is part of what a lot of the problem is. Health is not about how you feel. It's about how you function. Now think of pain, guys, like an alarm bell, right? When there's a fire that's raging in a room, yeah?
And
what do you want to do? Do you want to take the batteries out of the alarm? Or do you want to put the fire out, Doc?
We'll put the fire out.
As chiropractors, we treat the cause of symptoms. We put that fire out. Now let's face it, what does most of society do when they have symptoms?
Painkiller.
Yeah. Drug it out, cut it out, burn it out, right? Does that correct the underlying cause? Does that correct the underlying imbalance?
No.
No. And this is what we're getting to. So a problem can develop for years and years and years and years without you feeling a thing until before it's too late. It's a straw that breaks its camel's back, and you have something like the whole epidemic of lower back pain we have.
Because like you said, it's 80% of people.
Yeah.
So in a population, I'll keep it simple because I don't like maths. But if you had 10 million people, 80% is 800,000.
Yeah,
That's
absolutely.
crazy. That is crazy.
It is crazy.
So obviously there's more. Is it just like one lower back condition, or is there multiple different types of lower back problems?
Yeah, so when you look at the anatomy of the lower back, you have the spine and you have those bones, the L1 to L5 stacked on top of each other. You have those discs in between the bones, okay, and they act like cushions. So you can have things like disc bulges, most people here, or slipping a disc.
Mm-hmm.
That's when the disc is the problem. It can even get so bad it causes things like sciatica. And that's when you have lancetting nerve pain into the buttock, into the foot there.
Coming all the way down, yeah.
The pain can be localized to the lower back, or it can be referred usually like sciatica. Okay.
Are we talking like sharp stabby type pains or achy soreness?
So yeah. So there's two types. There's localized mechanical, and that's when the joints, the discs are involved, or muscles, or combination of everything. Or it's more neurogenic or neurological, and that's when it's like the sciatica, when those nerves that leave the spine, okay, or even the spinal cord becomes involved. That's what we call as complex or more neurological pain.
Okay. And what about for people that go, I want to sort of get a good idea of what my low back pain might be? What are some good ways that I can sort of check myself before I have to go get it checked by a chiropractor, or I have to go see my GP, for example? What are some ways to self-assess myself or know if I have a low back problem?
Well, the best thing to do is to see a musculoskeletal doctor, like a chiropractor.
Yeah.
Chiropractors is where the experts at the spine and nervous system and safely and efficiently diagnosing lower back pain.
Yeah.
And even we have the ability to differentially diagnose as well, because you want to make sure that your back pain is not coming from something that's dangerous, like a tumor or a fracture or some sort of infection.
Yeah.
But thankfully, less than 1% are coming from those sinister causes. But it's important to work out what structure is causing your pain, what's causing the pain, so we can come up with the best diagnosis and also the best management plan based on that.
Yeah. And another big popular topic that comes around lower back is always people talking about, I've got to strengthen my core. I've got to get my core solid
Yeah,
so I can have a stronger lower back.
100%.
So how does that all intertwine, play together?
Love it. Well, it's really broke up into two categories. So there's active care and there's passive care. So the combination of both is what the research shows gets you the best health outcomes. So care, it's not done for you, it's done alongside you, in partnership with you. And rehabilitation, exercises and stretches is the stuff that you do outside of the clinic to help strengthen those muscles that support the lower back. Things like core stability, core strength, super important when it comes to lower back pain. It's a part of the puzzle in terms of solving what's causing your pain and getting you good outcomes.
And you know what? I want to add to that, because a lot of people are so focused on the core. I've got to strengthen my core. Where's your core sit?
Yeah, that's a great question.
It's at the front.
Yeah, absolutely, you nailed it.
How do you train your back?
So, yeah, well, you got muscles. Yeah, you got muscles everywhere in the body, and so any weak muscles or any muscle imbalances, or even the way the muscles actually move in the coordinated fashion they're supposed to move, can create a problem. And so they need to be strengthened. So essentially, the rule is strengthen the weak and stretch the tight.
Yeah.
You'll never forget that.
And one thing that's always overworked is the lower back.
100%. Yeah.
Core's underutilized. Lower back is overworked.
Yeah.
So all these people getting all these lower back issues from all that repetitive stress.
Yeah, absolutely. Yeah. Either wear out, deconditioning, too much sitting, sedentary lifestyles, or you wear out from too much being a tradie, always on the tools, all that micro trauma over time.
Yes.
So you can't win.
It's all about maintaining.
Luckily, there's chiropractors there to help you.
And how about, you mentioned sitting down, right? You mentioned posture. So what are some good tips and strategies you can give everyone on ways to minimize the stress on their lower back?
Yeah. Great question, Oz. So essentially, when you're sitting, that's the most stress that you actually put on your spine. Yeah. So if you can, always opt for standing. Okay. When you're sitting, there's a lot more stress on the discs, the ligaments, the muscles. So when you are sitting, you want to have a good ergonomic chair, one that supports the spine. So it's going to be a contoured chair, armrests, and it also want to have head support and upper back support as well. Okay. Secondly, you want to make sure that I like to roll up a towel and place it underneath the small of your lower back, which helps support that lower back there if you're sitting for long periods of time, which is good.
I was just going to play devil's advocate and say I'm a crane operator, for example.
Ooh.
So I'm stuck in a seat for 5 hours non-stop operating machinery, sitting down. I can't get up.
Well, you're going to have to change careers. I'm sorry. Just joking.
That towel idea sounded pretty good.
Yeah. Well, there's modifiable things in your life and there's unmodifiable things. So if you're stuck in a crane, that's unmodifiable. The best thing you can do is change your position, change your posture. Okay, try and move around, get that towel in there. But things that you can modify is, if you're sitting at an office, okay, or if you're doing a lot of sitting at uni or at work, is to get up every 20 minutes as well and stretch.
Yeah.
It's this passive loading of tissues over time with no break is what causes a lot of this ligamentous creep and damage and micro trauma over time. Yeah.
And that's what gets missed. That's what always gets missed.
100%.
Because, and you mentioned a couple good routines and habits that people can start to implement, which is like getting up, stretching. Is there any particular names or name of exercises that you can think of that people should do as a general, like a nice round?
Yeah. So getting up and stretching, any relief position, just breathing and stretching, okay, doesn't need to be long, 3 to 5 minutes of just some general mobility exercises, okay, breathing in, breathing out, just to reset the lower back, reset the nervous system is important. Breath is very important as well, okay? When we oxygenate ourselves, we help reset everything. And then obviously with any rehab, any stretches and exercises, anything that's Pilates based, yoga's based, okay, anything that stretches out the problematic area, we can go through. And the rehab we can go through in detail with. Everyone is going to have a different rehab program based on their problems.
A general rule of thumb is I don't recommend people do sit-ups, right, as their core strengthening technique or low back strengthening, because you do a lot of arching and it's done a specific way. So normally I'd recommend like something more gentle, like a dead bug or a hip bridge, but it's still important that you get it assessed first because you want to make it really specific to target the areas that are weak.
Yeah, absolutely.
Rather than overworking what's already strong. So that becomes 100%. Really, really important as well.
Absolutely.
So let's go into a really, really good topic. Right? So let's say I've got niggles in my back. I've had it for years. What are signs that I should look for to get my lower back checked? Let's say I have any niggles or I don't actually feel anything wrong, but now I'm thinking I might have a low back problem. What are some ways for me to know if I should get checked or not? Yeah.
Well, a lot of the time is you have some sort of body signal. Pain being the biggest motivator. Okay. You can also have a bunch of other symptoms as well. Okay. When the lower back's involved, it's a pretty common symptom. Lack of range of motion, stiffness, knee symptoms, ankle symptoms. Okay, you can even have those nerve pains, those nerve symptoms as well.
How could your knees relate to your low back?
Great question. So your knees rely on neurological control from your lower back. Okay, literally the nerves L3, L4 that leave the lumbar spine, they go in and they control the function of the knees. So the big question getting asked these days, is it actually a knee problem or is it a connection, a Wi-Fi issue coming from the lower back there?
Okay.
Because a lot of the time as chiropractors, people will present, or patients present with knee problems. We don't even touch the knee. We correct the underlying imbalance in the back, which then helps the knee balance. Knees are usually just a compensatory problem for something spinal.
Because I was also going to say, sometimes you see people that don't have level hips, or when I'm walking, I feel like I'm stepping more on one leg compared to the other leg.
100%, yeah. Short leg or leg length inequality. There's a lot of people out there walking around in circles, quite literally.
Whoop, one leg just keeps dragging me around.
You see what I mean? So you want to walk nice and even.
Yeah. So basically, those are some good ways to check to know if you should be like, hey, I should actually get my low back checked and see if I do have inequalities or if I have knee pain or feet pain.
Big time.
Could be coming from my lower back.
Big time. Symmetry's the word. Okay, it's all about symmetry.
Balance,
symmetry. Remember, structure governs function. You have altered structure, you're going to get altered stresses through those joints, and you have to, by laws of physics, have to have altered function.
Yeah.
And the role of a chiropractor is to come in and make sure that interference, that underlying imbalance is sorted so your body can do what it needs to do and work with less interference and less stress.
Okay. Well, let's get into a really important topic. Let's talk a bit about the myths.
The myths.
The myths around lower back pain. The myths around the treatment around lower back pain. Right. Let's talk a bit about that. And this is a massive topic. Okay, so I'm going to keep it pretty relevant and straight to the point. Let's talk about, starting off with, is the different types of treatment for lower back. Right? I want to specifically talk about what's most commonly given to people for low back pain.
Yeah.
Which is painkillers, bed rest. What are your thoughts around that?
So, most common treatments given are painkillers and stay at home. Literally cannot be any worse for low back pain. So, medications, unfortunately, they only mask the symptoms. They don't address the cause, period.
Yeah.
Okay? And let's be honest, they make you feel good while you're on the way down. And there's a lot of side effects to medications as well, okay, which is out of the scope of this talk, but at the end of the day, drugs only hide symptoms. They don't actually correct the cause of the issues, which leads to why back pain doesn't get treated properly and gets worse over time.
Yeah, it festers, right?
Yeah.
So if I got back pain, I take a painkiller, hides the symptoms, puts a band-aid over it, and I continue to go back to work. And the same things I've been doing that's been damaging my lower back get damaged even more because I'm just masking where it hurts to push myself.
Yeah.
What happens now is I'm even worse.
100%.
Those painkillers don't work anymore. So what do? I get stronger pain meds. Repeat the cycle. What happens when you run out of pain meds?
Yeah.
Which is going to come to my second question. Is surgery.
Yep.
Either lumbosectomy, discectomy, or lumbar fusion.
Yes.
Talk to me a bit about that.
Yeah, so look, lower back surgeries, research shows that they're not effective. In fact, 40% of lower back surgeries have a failure rate, meaning 40% of people who go to get surgery on their lower back don't get successful outcomes. They're actually worse off at the back end of the surgery. The reason why surgery is not that successful is because they've operated on the wrong area. That's not even responsible for the cause of their symptoms, meaning they've operated on an area that's painful. That's not even the cause of the symptoms. So you go and change someone's structure permanently. Do you correct the cause? Do you correct the underlying imbalance? No. Does that help to rehabilitate the spine? The answer is no. And a lot of the times, unfortunately, after dangerous surgery, lots of expenses, you're left worse off with worse outcomes, not better outcomes.
Yeah.
And that's just a fact.
It's a scary thought Because what you said there was it's permanent.
Yeah.
And when something's permanent, you can't reverse it. And what you see nowadays is younger and younger people getting back surgeries.
100%.
We're talking 30s now, you know, and you've got your whole life ahead of you, but now you've just limited yourself in what you could do for the rest of your life because you can't reverse it.
Absolutely.
So, what are some other wellness and more innovative? I can't even say the word right now.
Innovative.
No, not innovative. Invasive.
Less invasive.
Less invasive.
Yeah.
Thank you. It was gone. I could not say it.
Yeah.
Innovative.
Yeah. So things like conservative movement-based care is where it's at and where the future is going, which is a salutogenic model, meaning doing things that work and uses the body's ability to heal itself.
Awesome.
Because at the end of the day, your body is smart and it can heal itself. It just needs less interference to do that.
Yeah.
Chiropractors, where primary healthcare practitioners, we're trained to assess, diagnose, manage, and treat lower back pain from a conservative point of view, without drugs, without surgery, and we are trained in the normal structure and function of the spine, and also in working out why something has gone wrong, so we can actually treat the cause of the lower back pain and get good outcomes.
Yeah.
Without relying on drugs, without relying on surgery. And unfortunately, people see a chiropractor as the last resort, when in reality, if you look at the research and you look at the outcomes in chiropractic compared to other healthcare interventions like drugs, like surgery, chiropractic comes out on top with efficacy, safety, and cost effectiveness.
Yeah. And
It's a no-brainer, really.
Yeah. It's basically the number one success strategy in terms of lower back pain.
Chiropractic is a lifestyle success strategy. Healthy human beings.
So, is there a success story or someone that comes to mind when you think about lower back pain and how their life changed?
Yeah. So I've got one good story. So I won't say his name, but gentleman who came in a couple of years ago, and we're talking about surgery. This man was at the end of his patience. Okay, he was pretty much disabled on the bad end of a surgery gone wrong. So he had chronic, debilitating lower back pain, which was interfering with everything. He couldn't work. He was housebound. His wife pretty much had to just look after him, get him changed, feed him. Couldn't be the father he wanted to be to his kids, and he couldn't be the husband he wanted to be to his wife. He sought care as a last resort from us, and he said, I need your help. So we did all the testing, did the scans, did the history, came up with a diagnosis, and we said, look, this is a problem that we can help with, okay? Because we see a lot of people on the back end of failed surgeries, unfortunately, okay? We started helping him, and over 4 months, which is the initial sort of phase of care, he had some pretty good changes. And now, years later, he's actually managing his own lower back pain. He's symptomatically improved so much. He's walking properly, and most importantly, he's back doing the things he loves doing. Walking around, working, being the father to his children, being the husband to his wife that he wants to be.
That's probably the biggest one that resonates with me.
Yeah.
You know, I can't imagine just not being at your best to be there for your family, you know? Especially when you're meant to be someone who's meant to provide, look out for the family, work together. But now you just become someone that's become dependent.
It's sad.
It's a very, very, I know who we're talking about now. Yeah. And it's insane. So, that's a great...
Next question.
I know, right? Yeah, but it hits me hard.
So many stories, and it's part of what
Hits me hard.
is the best part of being a chiropractor is seeing transformations occur, and getting to see people throughout their journey, and seeing people throughout their wellness lifestyles.
Yeah. Let me refocus. All right. What about, you mentioned our discovery process, our day one, how we assess people.
Yeah.
Could you just go into that in a bit more detail and how we assess people, how we look after people here at the Back Doctor?
Yeah, so we do a complete health checkup, okay, which is a day 1, day 2 process. So day 1 is all about data collection, okay? It's focused on identifying your problem, working out whether chiropractic can help you or not, yeah? And essentially we do a big, deep analysis of your body and your health and where it's at, what's working, what's not working, okay? From history, examination, palpation, muscle testing, neurological testing, orthopedic testing. We also do comprehensive posture analysis, how you move, and low-dose digital x-ray as well. All the data collection, diagnosis, day 1. Day 2, this is when we give you our results or your results of where your health's at and whether we feel we can help you, whether chiropractic is for you. It's a comprehensive process, but we get all the ducks in the row so you can make an informed choice when it becomes your health.
Not only is it fully in depth, one extra additional thing I always like to mention is the x-rays are done in-house.
Beautiful.
So you don't have to go somewhere, take x-rays, wait forever for the results to come in, and then go get yourself, finally get it checked. It's almost instantaneous.
Absolutely.
So,
and objective as well. Because to see is to know, not to see is to guess. So, as chiropractors, we want to have a look at your health. We don't want to guess, do we?
You're full of quotes, man. Full of quotes. Give me another.
The quote,
please. Give me
Another
quote,
one?
please.
Well, it comes down to this, Doc. Is the power that made the body heals the body.
Oh, too good.
Don't put more faith in drugs and surgery than in the power that animates a healing body, which is your nervous system at the end of the day. I'm warming up now, Doc.
Give me one more.
One more now. I'll tease you.
All right. So we'll start wrapping up for this episode.
It's gone so fast.
It flies by. What would be one piece of advice that you would give to everyone listening into this podcast right now?
It's to, if you know someone who's struggling, consider chiropractic to them. Okay? Consider chiropractic. Procrastination is the enemy to health. That's when we know we should do something, but we don't. And too far, unfortunately, as a chiropractor, it makes me sad to see the amount of procrastination that people have had with their health. Not sure, been pointing in the wrong direction. Time is ticking and your health is at the expense a lot of the time. So make the leap. That first step is the most hardest one to take, but it's the most important one to being more aware and going on a healthcare journey and getting your health where it needs to be. So take the leap of faith. Try chiropractic out. You won't regret it.
Can I give one piece of advice as well?
Please.
One from one doc, another from another doc.
Please.
It'll be to say, don't get to the point in your life where you're at an ends meet, where you can't work for your family, you can't provide, everyone's looking after you, you become the reliant. Don't wait, because it's going to happen. But the difference is, do you want it to happen when you're 30, 40, 50, 60, 70, 80, 90? If you make it to 90, amazing. But don't wait. Don't leave things to fester. Yeah.
And don't wait till how you feel.
Yeah.
Because the best time to get checked is when you feel you don't need to get checked, based on,
And you'll find out if you do need help or not.
100%. Feeling, function over feeling.
Yeah.
Is the most important.
Because if you get checked and you go, boom, there's nothing wrong with you, beautiful. I don't have to stress.
Yep.
I can get checked later down the track and be like, I'm still good. Or, okay, I need to get this addressed now before it becomes a big problem.
100%.
There's no harm in getting checked. It's actually more beneficial, prevention.
100%. 100%, Doc.
Alrighty, I think that'll wrap it up. That
Thank
just
you.
fired me up too much. We'll
Good
say bye
stuff,
to
man.
everyone.
See you later, everyone. Thank you.